ladies! Have you just found out that you are pregnant? Congratulations! And today, we'll discuss everything you need to know about being 3 months pregnant, including your baby's development, common symptoms, and what you should do at this stage of pregnancy. So stay tuned till the end of the video. At 3 months pregnant, that little ball of cells has turned into a tiny human, complete with all the organs and body parts that will help them survive outside the womb one day. But there's still lots to look forward to in terms of baby growth in the coming months. Let's dive into all the details. First, let's talk about your baby's development. At 3 months, also known as 12 weeks gestation, your baby is roughly the size of a lime and weighs around 1 ounce or 28 grams. All their major organs are developed and functioning, including the heart, lungs, brain, and digestive system. The sex organs have also started to form, but it's too early to tell whether you're having a boy or a girl. Some lucky parents-to-be will get a glimpse of their baby's sex during this time if they're lucky enough. In fact, we made a video about what you can see at each ultrasound. We'll leave it in the description box below so you can check it out after this video. Facial features like the eyes, ears, nose, and mouth are taking shape and becoming more defined. Tiny buds that will eventually turn into fingers and toes are present, and the arms and legs are getting longer. The brain is rapidly developing, and the spinal cord is starting to form. Your baby's heartbeat is strong and can be detected with a Doppler ultrasound machine. While the baby's heart starts to beat around 21 days after conception, the heartbeat can't be detected until 10 weeks because it's too weak to listen with a regular stethoscope. However, doctors usually wait until the 12th week to listen to the heartbeat because before that, not all babies have developed a heartbeat that is easily detectable. And even if you hear a heartbeat, don't start counting the number of beats per minute. 120 is a myth. Instead, there is a range between 140 to 160 beats per minute. Additionally, the heart rate shouldn't be consistent since the baby moves around a lot. Also, by the end of the 3rd month, your baby is able to swallow and urinate. So that's why sometimes you might feel some sharp jabs in your abdomen. Don't worry, it's just your baby moving. Now, let's move on to common symptoms at 3 months pregnant. As you transition from the 1st to the 2nd trimester, many of the uncomfortable symptoms of early pregnancy may start to disappear. But don't relax yet. You still need to watch out for new symptoms that may arise. The most common symptoms include thicker and shinier hair, skin breakouts, breast changes, dizziness, and nausea. These symptoms are caused by hormonal fluctuations and are completely normal. Some other less common symptoms include cramping, bloating, weight gain, sleepiness, frequent urination, headaches, food cravings, mood swings, and abdominal pain. Most of these symptoms are also normal and should go away on their own. However, if you notice any unusual discharge, bleeding, or pain, don't hesitate to call your healthcare provider. Let's take a closer look at each symptom. First up, we have thicker and shinier hair. One of the perks of being pregnant is having luscious locks. Thanks to those pregnancy hormones, your hair might appear thicker and shinier than usual. Enjoy it while it lasts. After your baby arrives, your hair may revert to its pre-pregnancy state. To keep your hair looking its best, use a gentle shampoo and conditioner. Avoid hot styling tools and opt for air drying whenever possible. A balanced diet rich in vitamins and minerals will also nourish your hair from the inside out. Next is skin breakouts. Pregnancy hormones can wreak havoc on your skin, leading to unwanted breakouts. If you're struggling with acne, don't panic. It's normal during pregnancy. Use a mild, nourishing cleanser twice daily and avoid scrubbing your face too hard. Consult your healthcare provider before trying any new skincare products. They may recommend ingredients like retinol, benzoyl peroxide, or salicylic acid, which are safe for use during pregnancy. Then we have skin changes. If you're expecting a little one, you might notice some changes in your skin as well. Pregnancy hormones can cause increased pigmentation, resulting in darker or patchy skin in areas like the face, chest, and back. To protect your skin from further damage, wear sunscreen with an SPF of 30 or higher daily. Consult your doctor if you have any concerns about skin changes during pregnancy. Another symptom is increased vaginal discharge. During pregnancy, it's common to experience more vaginal discharge. As long as it's clear or milky white and odorless, it's perfectly fine. However, if you notice a change in color or consistency, or if it has a foul smell, contact your healthcare provider. Yeast infections, which can cause a thick cottage cheese-like discharge, are common during pregnancy. But don't worry, they're easily treatable. The next symptom is what we call baby brain. Have you ever found yourself forgetting where certain things are or losing track of what you were supposed to do? You're not alone. Many expectant mothers report experiencing forgetfulness or mental fog during pregnancy. Blame it on those pregnancy hormones or the fact that you're constantly thinking about your baby. Just make sure to keep important items in easy-to-find places and write down reminders when needed. It's all part of the journey. Moving on to nausea. If you've been battling morning sickness, I have some good news for you. It should subside by the 4th month. But until then, try eating small meals throughout the day and sipping on ginger tea. If it persists beyond 14 weeks, or if you can't keep fluids down for 24 hours, contact your healthcare provider. Finally, breast changes. As your breasts prepare for breastfeeding, they may feel heavier and more sensitive. Not to worry, though, this is completely normal. Stick with supportive, comfortable bras, and you'll be feeling better in no time. And don't forget to stay hydrated. Drinking plenty of water will not only keep you healthy, but also reduce breast tenderness. Then we have dizziness. If you suddenly feel lightheaded, don't panic. Dizziness is a common symptom of pregnancy. It's often caused by increased blood volume. If it happens, sit or lie down and breathe deeply until you feel better. Just make sure to stay hydrated by drinking plenty of water. Now, let's move on to tips for the 3rd month. Continue maintaining a healthy diet rich in essential nutrients, including protein, iron, folic acid, iodine, choline, calcium, and vitamin D. Stay hydrated and limit caffeine intake. Monitor symptoms closely and contact your healthcare provider if needed. Prepare for the 2nd trimester, including upcoming appointments and prenatal care. If you've had a positive pregnancy test but haven't seen your OB/GYN yet, make an appointment. Your first visit should include a physical exam, urine analysis, blood tests, and an ultrasound confirmation of pregnancy and gestational age. Your provider will also teach you how to monitor your baby's kicks and other safety measures to ensure a healthy pregnancy. In addition, most first-time moms will have an anatomy scan between the 18th and 22nd week of pregnancy. And don't forget to download our app, which includes a kick counting feature to monitor your baby's activity. We'll leave a link to it in the description box below. If you want to learn more about pregnancy symptoms and signs, we made a video about the different types of pregnancy tests and their accuracy. You can find it in the description box below. That's all for today. Thank you for watching this video about 3 months pregnant, including your baby's development. If you found it helpful, please leave a thumbs up and share it with your friends. Don't forget to subscribe for weekly updates on pregnancy, birth, and motherhood. See you next time.